Okay. So welcome everybody to the webinar about using Therap and meeting state-specific regulations in Nebraska. I am very happy to introduce to you today Mary Lawson, who is the Executive Director at PAKS Developmental Services in Nebraska, and she has been involved in our field for quite some time as a certified trainer with Therap, has presented at different conferences, and is going to help us out with the presentation. And I will be monitoring the chat box for questions, and we'll let Mary know if there's questions. And I will keep everybody muted, but if I need to unmute somebody so that they can ask a question, I can certainly do that. So I'm going to hand it over to you, Mary.
All right. Thank you. Good morning, everybody from Western Nebraska and across this state of ours. It is a beautiful March day out here. When I stepped out of my house and there was no wind, it's like this is not a normal day. So anyway, good morning again. I wanted to visit with everybody about how we here at PAKS and in Ogallala have worked to use the Therap to meet state-specific regulations and also help us be more efficient and effective in how we do business. So as everybody knows, we are undergoing dramatic changes in Nebraska, and as we speak, we are being presented with draft regulations 403. However, I chose to go over the 404s at this point. Johanna and I spoke a few minutes earlier, and we will do another webinar when the new Nebraska regulations are actually in force. And I've studied them. So anyway, welcome again today. I picked just a few of the things that we have targeted here to utilize Therap in, again, being more efficient and effective with how we do business. So the provider policies and procedures, the one thing that sticks out to me is that they have to be available to staff. We have lots of 3-ring binders. We have lots of paper. We have lots of dividers. I would say we did, because we began using the Therap system to provide those policies and procedures and make them available to staff at all times. How we chose to do that was by utilizing the ISP module. We created a Mr. Agency file. That is a person, he became a person in services. And understand that we were using Therap before Nebraska mandated it. So we purchased that person in our count every year as we renewed our contract with Therap. Today, with the state paying for the number of persons in services, it might become an issue if we all create a Mr. Agency. However, looking at the cost savings that we have had, I would be willing to pay for my Mr. Agency to the state because it has saved me a lot of time and a lot of money to be able to do it this way. So Mr. Agency has a New York ISP plan. You find that under the individual tab, and it is simply ISP. In the Therap world, I've always known it as the New York module. And again, it is simply ISP. There is no New York attached to the name on the Therap page. When you open that page, this is what the top of the page looks like. It is simply an ISP plan, and it is assigned out to Mr. Agency here in Ogallala. For those of you that have the super role to attach files, this is what the bottom of that ISP plan looks like. There are a whole lot of sections in between these screenshots that I've provided for you. So you may look at this ISP plan and be able to utilize different sections of this to be a benefit to your organization. Anyway, what we decided to do is we were going to add all of our policies and procedures and specific agency information into this plan. So super role privileges give people the privilege to add files, and this is what your page would look like if you have that privilege. You also have the privilege to download and remove. So when you update, review, you can remove the old ones and update to the new ones, the new attachment. So you just have to scan and attach. If you've got policies created in your electronically already anyway, then just add that file straight out of your computer drive. So this is what again, this page looks like this because of the super roles that you've been giving. When you make changes down here at the bottom, you will need to indicate what changes that you have made and provide an update. When you have updated this ISP module, staff will get a notification on their to-do list that there have been changes and updates. Their page, again, depending upon privileges and access within their super role, is going to look like this. They'll have a blue link to all those items that you've attached. They can open those and review them and read them, and that's one way for them to have access. When they acknowledge it on their to-do list, that's one way of you knowing that they have acknowledged that there's an update. Often, when there has been an update, we would send an SCOM with information, simple information saying that we've updated a policy and they need to review it by a certain date and time. And then as a QA or administrator person, you can pull an acknowledgement report to see that staff have actually acknowledged. And that report will look like this. And that report lives in that ISP. Now you can discontinue and create a new one annually. There are lots of different options in there, but this is how we have chosen to make our policies and procedures and agency information that's pretty static available to staff at all times. Most of the time, Therap's open 24 hours a day, except when they're going to do some updates. So the overnight shift can access policies. It has saved us failing to get a 3-ring binder updated because we didn't get the copies made in a timely fashion and something had changed. We're also interested in having a truckload sale of all of the 3-ring binders that we have left. So if anybody's interested in that, but I hope you're not. And if anybody knows of a Pinterest project that we can do with all of our 3-ring binders, please let me know, because we are overrun with going paperless. So the next thing that I pulled from the policies and procedures is the entry to services. And this is a Nebraska and Therap project as they built our referral module in Nebraska, because not every state has these options. And I just have this simple screenshot. Those of us who are providers are, I hope, aware and familiar with this already, but it is so beneficial in allowing us to access information that case managers have posted regarding a person requesting services. It's a fast and easy way for us to ask for additional information back and forth between service coordination, and we can electronically accept and deny those people that have been referred to us. And again, that referral process begins the intake process for the Nebraska provider. And it needs to be done this way in Therap for the systems to connect for the person served, so they can get their service authorizations and everything that they need connected with the state and the provider. Then that access to the DD provider, we must allow access by department staff to all of our records. When we began Therap, and had CERT reviews, we have had 3 CERT reviews since we began using Therap. Before state mandated and state service coordinators had access, we set up uniquely individual logins for those surveyors and separate caseloads for the people that they were going to review when they were here. Today, Service Coordination has access. I'm honestly not sure if Public Health, who do the CERT reviews, now have Therap access within their own. But I would do the same thing. If they came out here today and wanted access to our Therap system, I'd give them a unique username and set up a separate caseload for those people that they wanted to review. Our staffing requirements. The training management system has been a great benefit to us also. You find the training management system under your agency tab. You develop your classes, courses, and curriculum. You have to build all three of those as a database. They can be changed at different times. We began basically with just standard training classes that were required, or even more than required, things that we wanted to train our staff in. So we developed those classes and courses. Over time, we have decided that we are going to track our staff meetings there, because you can scan and attach the signature sheets, you can scan and attach the competency exams, you can track all the new hire information in there. Actually, went one slide too far, so we're going to go back. We track our one-on-one staff meetings in there. We are going to be tracking our annual background checks, because the beauty of some of this is you get a due number on your face page in Therap when something is due. So staff should be aware of those numbers and know that they have something due that they need to get completed. Again, you design it to work as effective as possible. We have every new hire orientation piece of paper that's required to comply with this regulation in our training management system. Then a bigger piece of how we use Therap is that habilitation process. And as everybody knows, the ISP module is mandated within Nebraska. Sometimes what I think we forget is that it's a combination of all of those. It is the personal focus worksheet, the agenda, and the individual support plan. Oftentimes, and guilty as charged, we go straight to the individual support plan and only look at that and don't consider the personal focus worksheet and ISP agenda as we're providing services and supports throughout the year. And yet it is a combination of all of those that makes a complete document. Our next feature that we implemented is, as soon as I knew it was available, were the custom forms, because the Nebraska's Developmental Index popped up on our custom forms in 2012. There's also a comprehensive assessments and service needs and preferences document that we use as assessment summaries. There are a myriad of custom forms available in there that you can import into your organization and then assign them out to the person served, and they live in their master file within Therap. And you can go in and review and update annually. No need to create another paper form. The vocational side of services can look at that developmental index, and the residential side, if you have guardian access, they could actually go in there and view that also. So no more passing paper back and forth, no more losing paper, it went somewhere, oh, I'm not sure where it got filed, or all those things that we've heard. So you find these in the Global Template Library, the custom forms. Make sure to choose access carefully, because if one person who has access imports the developmental index and then Joe across the hall has access and imports a developmental index, you will have two forms loaded, imported in, and you don't need that. So you only need one, so limit access to people who download custom forms, just so you don't have to go back and delete, because if Joe uses one of them and Alice uses another, then you can't get rid of. Once they've been implemented in somebody's file, you'll have to keep them both. The next thing that's made our work a lot easier and more efficient are the ISP programs. Again, they are on individual tab ISP program. We utilize those for personal glances, the network relationship maps, rights reviews, fire drills, in addition to the traditional habilitative teaching plan. They are that teaching plan, the staff supports, all of the things that relate to that person that may not be required, but some of the things we choose to do, the likes, the dislikes, the important to, important fors. Some of those we have stacked all together into one ISP program. But again, they're available to staff to look at, to update when I'm supporting someone and I have learned something new today about what's important, what's non-negotiable for the person that I'm serving. I can go right in there and update my personal glance, and I don't have to wait till I that piece of paper or 2 weeks before a meeting when I go in, because I may have forgotten what Alice had told me that was important to her that day, or that she didn't like, or that never wanted to do that again. Also in ISP programmatic format, depending upon requirements, requests, person served, you can set them up so the beginning and ending time are there, which I believe is going to be very important as we transition into some of our newer codes and we need to track our ins and our outs. And the location of where the service is provided. You can make that mandated when you set up an ISP program. Now, again, that's been a benefit for us, that so we know where the service was actually provided and the times that they were actually there. So again, set your ISP programs up for the information that is required coming out of them. It allows you to do a lot of tracking. I learned at the national conference this year, a lot of organizations are stacking. And when I say stacking, they're putting the majority of things about the person in one ISP program, because you can have 30 tasks in an ISP program. So it makes it easier for staff to only have to go to one spot to do their documentation. Monitoring reports. This is another thing that has saved us a lot of time and a lot of paper. Monitoring reports can be generated in Therap. You have 4 options to look at. We were told by surveyors that they preferred the clinician report, so that's traditionally the one we save as our monthly monitoring report. But you can do your pre-implementation reports, you can do a mid-month monitoring report, a monthly monitoring report, you can do it. Your programmatic report's going to give you numbers and percentages. Clinician report's going to give you those narrative pieces if you've asked staff to input in any of the comments. And that's how we do our monthly monitoring for our agency, is in Therap, in the clinician report. And it is saved in Therap, and at any time you can go back and search them back out. So far we haven't lost one or gotten rid of one. It's also, when you pull a report like this, it's at a glance. The HAB report, it's at a glance. It's a simple, fast way to see the documentation that staff have done. More requirements, we need an IPP team process. So in the individual data form, which is individual data on the individual tab, you can add team members. And actually, Service coordination can be added as other, because they don't, at this point, they don't link in the team members section, but you can add, that is a requirement that service team members are listed in service coordination is in the file face sheet. So we chose to put it in the IDF, the individual data form, to meet that regulation. Signature sheets are also attached to the ISP plan, so that's, you can see what team members were present at that ISP meeting. The next regulation that I want to talk about is that behavior support piece. In Therap, again, is a custom form for positive behavior supports when psychotropic medications are in use. This is the one that we have chosen to import into our organization. We just felt it could be very detailed, and so we have implemented this one. You have too far. You have 3,000 characters in each one of those boxes to explain the desired alternative behaviors, the behavioral objective, including your measurable criteria. So again, this plan lives out there with in their profile, and it can be reviewed and updated annually or as needed. Again, you find it in custom forms under your global template. And then again, positive behavior supports, often on the other side, we're tracking the targeted or maladaptive. So in Therap, there is the module for the behavior events and behavior plans. This is what a behavior plan looks like, could look like. Again, you set it up the way your organization needs, but this documentation of a maladaptive or targeted behavior goes into quite a bit of detail to help us determine why. It also allows all of these blue links here, when it's interventions, there's a description. You put in a description for staff that they can click and link to go, okay, so now I forgot exactly how I'm supposed to. So they can click this open and review it again at any time. So, and the behaviors that run across the top, you again add the description of what that means, because so many of us interpret anxiety so different. When you have a detailed explanation right there, then staff know exactly what they're looking at, instead of just saying, oh, he looks like he's anxious today, so I'm going to chart this in. Again, big benefit, reviewed, updated annually or as needed, determined by the team. Much easier than paper, printing, filing, hole punching. Reports, I tell you, the psychiatrists and the docs love the reports that Therap pulls for these types of things. Notice of costs and authorizations. We started using the consents and authorizations module for anything we as an agency need to gain consent for an individual that we serve. We have, again, our annual releases, our direction and monitoring. We have the rights review paperwork scanned into a person's file. Again, you as an agency decide how you want to use this. I see on this particular list that acknowledgement of risk behaviors, plan dates, informed consent, DNRs have been attached in here, rights review, photo releases. Again, utilize this to keep track of those things that we need to gain consent for. There are so many places that Therap will allow us to store information about the person served that, get your team together and make a decision on what you're going to put in consents and authorizations. Because it's an easy place to store things, a lot of organizations begin truly without a plan in mind and end up putting things in there that may not necessarily belong. So part of this process is determining what the agency wants and needs and where you're going to place all this information. The personal finance module, how we track management of individual finances. Again, we've been using this for several years, and it has worked well for several reasons. When I'm supporting Alice in the community, I can go find her budget because we prepare a budget annually for everybody. We prepare a financial plan, which is attached to the IPP, but the budget is attached to the person's New York module ISP. So as a staff person, I can go look at the budget, and then I can pull up the personal finance module and see how much money, for example, I've already spent on household replace and repair category, or how much I've already spent of my clothing budget. So it's allowing staff to be empowered with that information. They can be logged on with the person served sitting right there beside them to go, okay, so this is how much money you have, and you've already spent this much money, so we'll need to figure out how we will spend the rest of your money, or how you need to spend the rest of that clothing budget or even the grocery budget. Puts information out there for the DSP to do their job much better when we're using the modules that Therap provides. You can get a report to send to those guardians out of this personal finance module. And the other best thing that we've begun using is you can scan those receipts right into the Therap module. I'm a big no more paper, please, thank you. So the utility bills, all those receipts that when people go grocery shopping that we need to keep, scan them right into the Therap module, and they're available to anybody who has access and the privileges to view this module. So this has been a big benefit for us for those reasons. And then of course health services and our need to track and keep a file of all of those health tracking. And all of you know that the health tracking module has been mandated in Nebraska for July 1. So anything that's in here that applies to a person served, the DSP at that level, again, my opinion, that's how it works in our organization, can input that information. It helps us serve the person better because, again, that information is right out there. You can link and track those appointments together so you know how many times I went to the neurologist or to the podiatrist, or how many times I saw my primary care physician, because we have those appointments linked together. We print a physician contact form, and when we're done at the doc, we scan it right back in and attach it to that appointment. We add our appointment results in the health tracking appointment section, and again, we're done with a medical paper file. The MAR, again, no more copying, no more 3-ring binders of MAR sheets and data sheets and count sheets, and it's readily available for staff. Reports that pull out of here, you can go look at skin wound information when you're preparing for the next meeting. Anything that gets put in there, the reports to help us serve the person better are so easily accessed, and just availability of the information that's in here to me is just amazing, and how it benefits us as we serve people. So the last requirement is that we have an individual record. So the provider must develop and maintain a record-keeping system that includes a separate record for each individual. Well, that's what Therap does. That's what Therap does for us. And this is a screenshot of an individual homepage, but we call that our electronic master file because we don't have master files anymore except in Therap. We've reduced our paper by that much, and we've been using Therap for enough years that we have all of our history is truly in the Therap system. So that is how we here in Ogallala have worked with Therap and utilized the Therap system to meet these Nebraska 404 regulations. So does anybody have any questions or thoughts?
If anybody has questions, I can unmute you to make it easier to ask the questions. You can just let me know in the chat box. Mary, I like the way that you talked about the specific regulations and what modules in Therap could help with those. I really appreciate the time you put into making the presentation and the PowerPoint. The way that it's organized, I think, is very helpful. And I think it's always wonderful to see practical applications of how you apply different modules to meet the different regulations, since we do have such a wide variety from state to state and place to place.
Yes, and even provider to provider, because here in Ogallala we provide intermittent services. So we no longer have the 24-hour continuous. So the way we've set things up, will be different than people who provide a different type of service. But it is still so much information that you can place in here to help us be more effective in how we provide services and more person-centered. I think it's great that a person that we serve can be actively involved in looking at their Therap file in their own home and reviewing that with staff and knowing exactly what's in there. If they want to know, because I had the thing of, are you writing me up again this week? And it's like, that doesn't happen anymore when someone can look over your shoulder and see exactly what you're doing with their information. So I just think it's great. I mean, we've used it for years and I'm very happy we made the decision.
Well, and I think it's exciting that in your quest to moving towards being paperless, that you've got a bunch of empty 3-ring binders.
Yes, would you like some?
I'm trying to get rid of some myself, but those are the things where it gets exciting because you really have accomplished a goal. And I think that almost everyone has a long range goal to figure out how to become paperless. And I know that sometimes it just sounds so much easier than it is, and when you finally get there, it's really nice. It saves trees, it saves paper, it saves time, and I think the real time access to information for individuals that we support is something that can improve quality of services and help people be more effective in their jobs, and improve quality of life for everyone, really.
Yes.
And I'm looking through here. I don't see any specific questions. Um, I feel pretty sure that Mary would be glad to answer questions if you guys wanted to reach out to her. We will work on getting this recording converted and posted on the website. That'll probably happen sometime next week. And I want to thank everybody for joining and thank Mary again for this. And I guess when we find out that they're changing some of the regulations in Nebraska, you'll have to do another one of these.
Yes, right. They're shooting us drafts as we speak, so I
So
guess we'll wait till they're confirmed,
I
but
do
we'll.
see a question. Would it be possible to get the PowerPoint? So what would be the best way if someone would like a copy of your PowerPoint, Mary?
Well, they could certainly email me if that's. My email is. Do you want me to just shoot that out there?
Yeah, if you're okay with that.
Yeah, it's Nebraska. The whole word Nebraska DSPS at gmail.com.
Did you get that, Tammy? Oh, perfect. Thank you. Wonderful. Okay. So thanks again for your time. I hope everybody has a great afternoon. And I'm glad it's a sunny day in Nebraska. It's pretty nice here in North Carolina as well. and we look forward to your involvement in future certified trainer webinars with us. Thank you so much.
Thanks everybody for coming.